You bring your perfect newborn home, their skin is just flawless, and then, bam. A few weeks in, their little face erupts in bumps. Okay, let's really dive into this because what you're seeing might not actually be what you think it is. Seeing a sun rash on your baby's perfect skin is, well, it's stressful. You immediately start to panic, you go to Google, and you find a million different and often conflicting answers. But what if I told you the term everyone's using, baby acne, is actually the real source of all the confusion? And this right here is the most crucial point we're going to talk about. See, one of these conditions is incredibly common and totally harmless. The other is a lot rarer, but, and this is a big but, it can cause permanent scarring if it isn't handled correctly. Our job today is to make you an expert at telling them apart. So, let's clear up all that noise. We're going to break down the two main things people are talking about when they say baby acne. And just so we're thorough, we'll also take a quick look at a few other common rashes that can look pretty similar. Okay, let's quickly rule out some of the other usual suspects. As you can see here, if you're just seeing tiny white bumps with zero redness, that's milia. It's just some trapped skin protein, harmless. If your baby is only a few days old and has these red splotches, that's probably erythema toxicum. It looks scary, but it's not. And if the patches are really dry and itchy, you're likely looking at eczema. Now, if none of those sound right, you're in exactly the right place. Let's start with the one you're most likely seeing on your newborn. It has a fancy medical name, neonatal cephalic pustulosis, or NCP for short. This is that classic newborn acne that pops up in the first few weeks of life. This is the imposter. And I mean it when I say it's common. Up to 1 in 3 newborns gets this. So if this is what you're seeing, please know you are absolutely not alone. It's almost a rite of passage for new babies. So what's actually going on here? Well, first things first, it has nothing to do with hygiene. It's a simple story. 1, your hormones are still floating around in your baby's system. 2, this kicks their tiny oil glands into overdrive. 3, a yeast that lives on literally everyone's skin, called Malassezia, sees all that extra oil and decides to have a little party. And 4, the result is that harmless inflammation you see as a rash. And now for the best news you are going to hear all day. The absolute best treatment for this super common rash is to do pretty much nothing. We actually call it benign neglect. Just keep the area clean with a little bit of water, gently pat it dry, and let your baby's body sort it all out. It almost always goes away on its own. Okay, time to switch gears and talk about the second condition, and this is where we really need to pay close attention. This is true infantile acne. It's way less common, but it's the whole reason we need to know how to tell the difference. All right, this slide right here is the most important one in this whole explainer, so let's really focus. Notice the key differences. The harmless rash, NCP, shows up really early, in the first few weeks. True infantile acne, on the other hand, appears later, usually after 3 months. But the number one giveaway, the thing you have to look for, is the presence of blackheads. If you see blackheads, you're dealing with true acne. Let's just define that term you might hear from a doctor. Comedones. It's just a medical word for the clogged pores we all know as blackheads and whiteheads. If you see these on your baby, it's a completely different ballgame. It's not that harmless yeast rash. It's true acne, and it's caused by a temporary hormonal surge that some even call mini puberty. And here is exactly why this matters so much. Unlike that common newborn rash, true infantile acne can cause pitting and leave permanent scars. And because of that risk, we don't just wait and see. Seeing those blackheads is your signal that it's time to get a professional opinion. All right, so now that we know how to tell these two apart, we have to talk about all the well-meaning but often harmful advice you're going to find online. Let's bust a few myths. This is probably the number one piece of advice you'll stumble across on those parent forums. It's natural, it's moisturizing. It has to be good for baby skin, right? Absolutely not. Please don't do this. Remember that Malassezia yeast we talked about, the one that causes the harmless newborn rash? Well, it loves to eat fats. Coconut oil is pure fat. You are literally setting out an all-you-can-eat buffet for the very thing causing the problem. And for true acne, it just clogs pores even more. Okay, what about this one? The breast milk facial. It sounds so ancient and wise, and we all know breast milk is basically liquid gold. So here's the honest-to-goodness bottom line. There is zero scientific proof that it works for acne. It probably won't do any harm, so don't feel bad if you've tried it, but it's just not a treatment. It's much better to stick with simple, clean water. Ooh, this is a big one. It is so tempting to look at those little bumps and think it's just from some dirt or grime, and that a good scrub will clear it right up. Please, please do not scrub your baby's face. Both of these conditions are driven by hormones, not by dirt. Scrubbing just irritates the skin, it damages that delicate protective barrier, and it will only make the redness and inflammation look and feel so much worse.
Okay, I know you've just absorbed a ton of information. So let's boil it all down into a simple, actionable cheat sheet you can use to feel confident about what you're seeing.
Here it is, your 4-point check. Number 1, check the age. When did it start? Number 2, check for blackheads. That is your biggest clue. Number 3, ditch the oils. Put away the coconut oil and thick creams. And number 4, watch for red flags. If you see really severe, deep acne along with other things like rapid growth, that's a definite sign to see your doctor right away. Look, being a parent is already filled with enough worries, and a baby's skin can be a huge source of anxiety. But I want to reassure you that the vast, vast majority of the time, these little spots and bumps are just a normal part of their development. Patience and gentle care are usually all that's needed.
But after everything we've talked about, if you're still feeling even a little bit uncertain, if you're worried, what is the single most important takeaway from all of this?
It's this. You know your baby better than anyone. Trust your gut. A quick phone call or a short visit to your pediatrician just for peace of mind is always, always the right move. They are your partner in all of this.